Hi friends, welcome to NCLEX Keys Academy. I am Boss B. If ECG strips have been confusing you, I want you to know something. ECG is not difficult. The problem is usually that the basics were not properly understood. Once you understand the foundation, every rhythm strip becomes easier to interpret. So today, we will start from the ECG basics and build your understanding step by step. Let us go. Welcome to NCLEX Keys Academy. Today we are going to understand ECG fundamentals, one of the most important topics in your NCLEX journey. The heart is not just a pump. The heart works using electricity. Every heartbeat starts with an electrical signal that travels through the heart muscle and causes it to contract. The ECG, also called EKG, is a machine that records the electrical activity of the heart. It does not show contraction. It shows the electricity that causes it. The electrical signal of the heart follows a specific pathway called the cardiac conduction system. The signal starts at the sinoatrial node, also called the SA node. The SA node is the natural pacemaker of the heart. The signal then moves to the atrioventricular node, called the AV node, which delays the signal to allow the ventricles to fill. After the AV node, the signal travels through the bundle of His, then splits into the right and left bundle branches, and finally spreads through the Purkinje fibers. This electrical movement through the entire pathway causes the atria and ventricles to contract in a coordinated sequence, giving us a normal heartbeat. Now let us understand what each wave on the ECG actually means. Remember, the ECG does not show heart contraction. It shows the electrical activity that produces contraction. The P wave represents atrial depolarization. This means the atria are receiving the electrical signal and are preparing to contract and push blood into the ventricles. The PR interval represents the time the electrical signal takes to travel from the SA node through the AV node. This pause allows the ventricles to fill with blood before they contract. The QRS complex represents ventricular depolarization. This is the biggest wave on the ECG. It means the ventricles are contracting powerfully to pump blood to the lungs and the entire body. And the T wave represents ventricular repolarization. This means the ventricles are relaxing and resetting electrically, getting ready for the very next heartbeat. Now here is the easiest way to remember your ECG waves for the NCLEX exam. P wave, atria contract. QRS complex, ventricles contract. Just remember this. P is for atria. QRS is for ventricles contracting. T is for recovery. Say it with me. P, QRS, T. Atria, ventricles, recovery. Say it again until it sticks. This simple trick will save you on your NCLEX exam day, I promise you. Let us now look at the normal ECG values you must know for your NCLEX exam. Normal heart rate is 60 to 100 beats per minute. The P wave should be present and upright. The PR interval should be 12 to 20 seconds. The QRS duration should be less than 12. Remember these numbers for your NCLEX. The QT interval should be less than half of the RR interval. If the QT is prolonged, it can indicate a serious cardiac arrhythmia risk. This is a big NCLEX topic. If any of these values fall outside the normal range, it may indicate a heart problem. Know these values by heart. They will definitely appear on your NCLEX exam. Before we can calculate heart rates or interpret rhythms, we must first understand the ECG paper boxes, because ECG interpretation is all about time and voltage. One small box represents 0.4 seconds of time and 0.1 millivolts of voltage. A large box is made up of 5 small boxes and represents 0.2 seconds. A large box is made up of 5 small boxes and represents 0.20 seconds and 0.5 millivolts. 5 large boxes equal 1 second. 30 large boxes equals 6 seconds. This is very important. Remember this for your NCLEX exam and for calculating heart rate. Always remember this important rule. Horizontal movement on ECG paper measures time. Vertical movement measures voltage. This rule never changes. Understanding these boxes helps us calculate heart rate, measure intervals, and interpret ECG rhythms correctly. Everything in ECG interpretation depends on understanding these boxes first. When interpreting an ECG, one of the first things we determine is the heart rate. There are 3 main methods used to calculate heart rates, and each method is used in different situations. Method 1, the 300 method, also called the large box method. This method is used when the rhythm is regular. Locate R wave, count the large squares to the next R wave, then divide 300 by that number. Instead of dividing every time, memorize this sequence. 1 large box equals 300. 2 equals 150, 3 equals 100, 5 equals 60, 6 equals 50. Method 2, the 1500 method, also called the small box method. This method is more accurate and also used for regular rhythms. Count the small squares between 2 R waves and divide 1500 by that number. Why 1500? Because there are 1500 small squares in 1 full minute on ECG paper. This method is more precise, especially when the heart rate is fast or when you need an accurate number. Method 3, the 6-second method. This method is used for irregular rhythms like atrial fibrillation, atrial flutter, and irregular tachycardias. Count the R waves in 6 seconds, then multiply by 10. How do we find 6 seconds on ECG paper? Count 30 large boxes, count all R within those 30 boxes, and multiply by 10 to get the heart rate. This is the best method for irregular rhythms. Here is a quick summary of when to use each method. Use the 300 method for regular rhythms when you need a quick estimate. Use the 1500 method for regular rhythms when you need more accuracy. Use the 6-second method for irregular rhythms like atrial fibrillation and atrial flutter. Know all 3 methods for your NCLEX exam. They are all testable and important. When interpreting an ECG, do not just look at the heart rate. You must follow a step-by-step schematic approach every single time. This approach will save you from making mistakes on the NCLEX exam. Step 1, heart rate. Is it fast, slow, or normal? Step 2, rhythm. Is it regular or irregular? Step 3, P waves. Are P waves present? Are they normal and upright? Step 4, PR interval. Is it normal between being 0.12 and 8.20 seconds, short or prolonged? Step 6, T waves. Are they normal, tall, or inverted? Step 7, ST segment. Is there ST elevation or ST depression? ST elevation may indicate myocardial infarction, a heart attack. This is extremely important on your NCLEX exam. Never miss this. If you follow this 7-step order every single time you read an ECG, interpretation becomes much easier and much more systematic. Never skip any step. They all matter for your NCLEX exam. Here are very important ECG tips to remember always. Always check rate first, then check rhythm. Every P wave should be followed by a consistent throughout the strip. QRS should be narrow in most normal rhythms. Wide QRS usually means a ventricular problem. ST elevation may indicate myocardial infarction. Irregular rhythm, use 6-second method. Most importantly, do not jump to conclusions. Always follow the steps. Read the ECG systematically every single time and your interpretation will always be accurate. Practice makes perfect. Let us do a quick summary. The ECG records the electrical activity of the heart. The electrical signal starts at the SA node. It travels through the Vegas and Purkinje fibers. P wave is atrial depolarization. QRS complex is ventricular depolarization. T wave is ventricular repolarization. Normal heart rate is 60 to 100 beats per minute. Use 300 divided by large squares between R waves to calculate heart rate. Understanding these ECG basics is your first step to recognizing cardiac arrhythmias on the NCLEX. Keep studying hard. Your success is coming. So remember, there are 3 methods to calculate heart rate. Use the 300 method for regular rhythms. Use the 1500 method when you want more accuracy. Use the 6-second method for irregular rhythms. And always interpret ECG in a step-by-step systematic way. Once you understand the basics, ECG interpretation becomes much easier. I am Boss B from NCLEX Keys Academy. See you in the next class.